All right. Well, good evening, everybody. Welcome to the Rodham Institute's Impact Speaker Series. I'm Dr. Gigi, and I'm the founding director. The Rodham Institute is housed within the GW School of Medicine and Health Sciences and is dedicated to improving health equity in Washington, D.C. for all of our citizens. Well, let me just give you a quick update about COVID. For the first time since the pandemic begun, we have no patients in our hospital who are on the respirator from COVID. That is a big, big milestone for us. We're very happy about that. We still have work to do in terms of vaccinating folks in Washington, D.C. We're doing better than some other places, but of course, we want as many people vaccinated as possible. The demographic that's the most challenging is the one between 18 and 45. So for those of you who've gotten vaccinated, please act as ambassadors, encourage people to get vaccinated because that's how we can all be protected and safe, especially those people that for whatever reasons can't get vaccinated. There are some people that cannot for medical reasons. So, I've always thought and said that the way that we are going to heal from this catastrophe that has been the COVID pandemic and really the whole vitriol of the last several years with all that's been happening, whether it's been the pandemic or the serial killings of Black people, or you can just name it. I've always felt that the arts were going to be the way that we all heal. And, it's been tough during the pandemic because, so many of the arts you actually have to attend in person, like live music and dance, but we have some great panelists today who work in this space and are going to help educate us about arts, but arts as it relates to healing and health and preserving good health and even treating certain conditions. So without further ado, I'd like to introduce our panelists this evening. Ms. Janine Tursini is a friend, first of all, well, they're both friends, is the executive director of an incredible organization called Arts for the Aging. Arts for the Aging was founded by an artist who herself passed on, Lolo Sarnoff, and who was just an incredibly gifted human being. And Ms. Tursini is going to tell us all about her and about the organization. She'll even show a video in just a few minutes. And then we have Ms. Jill Sonke, and she is from the Center for Arts in Medicine at the University of Florida, which is doing just some incredible work. And this is not a sort of Johnny come lately. This has been an established program and department rather for decades now. And so we at the Rodham Institute really want to learn from you so that we can duplicate and highlight the wonderful work that you're doing. So I think we'll start off with you, Ms. Tursini. Can you tell us about you and about your organization? And then we can show a quick video that you have brought with you.
Absolutely. Well, first of all, Dr. Gigi, thank you for having me this evening and highlighting the important work of arts and health and the value that creativity has in all of our lives. It resides in all of us. And so a little bit about Arts for the Aging, and then I definitely am excited to queue up a video. But we were founded in 1988 when art and science came together to improve the lives of older adults and caregivers across the greater Washington, D.C. region. And so we're going to jump into this video. I want to say that this video is kind of a representation of our multidisciplinary work in the arts and with older people and caregivers. And it'll give you a taste of what we looked like pre-pandemic when we were in person. And a little bit later tonight, we're going to show something from a virtual program. So you'll be able to see a little bit of in-person and a little bit of what we've looked like over the last year when we went virtual. So that'd be wonderful to share the video now. It'll tell you all you need to know about Arts for the Aging. There are a lot of older adults in our society that are becoming marginalized and less visible. I think it's our duty as a society to make sure that no individual should be left behind, and that includes older adults. Arts for the Aging is an organization that engages older adults, most of whom have some kind of physical or cognitive impairment, in all manner of art making.
Every morning I look forward to getting up. It cheers me up.
Arts for the Aging allow us to express ourselves, and it motivates us to dance and speak out.
The arts are a great way to bring people outside of the routine or the normal or the everyday.
When older adults are regularly involved in participatory arts programs, it actually improves their overall health and their longevity.
Wonderful. That was just a glimpse. And sorry, my cat is just insisting that I pet her. But I'd like to share sort of a personal story about Arts for the Aging, because I was on the board for many years, and now I guess I'm on the honorary board. So in our family, we have a number of artists. My sister's an artist. Matter of fact, if you can, all of her paintings are in my apartment here. Very gifted. And my brother-in-law is a musician. We've got musicians and filmmakers and all that. So when I was being asked to be on the board, I said, well, let me just kind of go and experience one of these programs. So I went to a nursing home, a senior facility, and it was Peter Burrows, the gentleman that you just saw being featured, an opera singer. And he had a program called Cooperate. So they wheeled out patients. And so for any of us who are caretakers or clinicians and we see how people look, they sometimes are not verbal, they may just be kind of out of it. And then he started his program. And people who had not been verbal for years started to sing. I remember this one woman was conducting, and the staff there were just amazed because it's like these people haven't spoken. And to me, that goes to the fact that music, especially music, is one of the most powerful. I think we were musical as human beings before we were verbal, actually. Correct me if I'm wrong, you guys are the experts, but it was so moving, and it brought tears to my eyes because, you know, older people, seniors are really, they're just wise. We should, I think the reflection of any society is how we care for seniors, how we care for children and families and the most vulnerable members of our community. And so to see that work through Arts for the Aging made me an instant fan. So, so anything that you would like to add before Ms. Jill talks and introduces herself and her work?
Yes, I'd love to. That was more of a glimpse than everything you need to know. So thank you for that opportunity. So, you know, in addition to music programs, we are a multidisciplinary arts organization. So we have a faculty of professional teaching artists that we train to lead these workshops, either online or in person, and they're skilled in all manner of the arts. So it's painting and drawing and dance and music and storytelling and poetry programs, interdisciplinary programs, teaching artists collaborating with one another. And now, since over the last year, since we've had to reinvent because of the pandemic, these live workshops can take place online. They can be, you know, video, or we sometimes have telephonic callers on our Zooms as well. And we also have pre-recorded programs. So some of our client partners in the community have been using short segments, 3 to 15 minutes, whatever we customize our programs to the needs of the community. And they've included them in these on-demand, you know, hour-long programs that were a segment that's being shown to families. Some families have had watch parties with our programs. And then we also have something called Heart Kits that we developed over the last year to try to help bridge the digital divide. So not everybody has access to virtual platforms. And so our teaching artists, visual artists have made these really personalized, customized kits that come with art supplies, instructions for use. They're great with family members as well. Sometimes they come with projects that can be mailed to loved ones. So the whole idea behind the program, generally speaking, is to get people participating, making something, putting something new into the world. We're validating all levels of participation and potential, all for the benefit of getting people to communicate with each other in new ways, and use the arts as the entry point to start a conversation as we combat isolation and loneliness.
Wow. So when you're talking about mostly seniors that you're serving, there are also a good number of them that may have some cognitive impairment. Is that right?
Yes. So we were born out of a study that Lolo Sarnoff, our founder, had conducted with some of her former colleagues at the National Institutes of Aging, that showed that when older people were involved in an arts activity, older people with Alzheimer's disease, that their moods and behaviors improved. So that was her aha moment. She was an artist as well as a scientist. And so she blended those two passions, those loves of hers, and started Arts for the Aging. So most of the clients that we're reaching do have some kind of physical or cognitive impairment, but our reach extends to also older adults as well, thinking about preventative measures.
I think that I've actually referred some of my patients, and what's great is that it's not only for them, but it's for their families. I love how you have sort of talked about that, because especially for anybody who has either themselves or a family member that's dealing with cognitive impairment, there is just such a frustration that can happen, that caretakers can get burnt out and frustrated and not know exactly how to be helpful. I also love the fact that you're conscious of the disparities that exist, and the digital divide is a real issue. I learned something actually from one of our webinar series when our geriatrician colleagues joined us, that where I live in Ward 3, there are about 8% of seniors who have cognitive impairment. But in Ward 8, it's actually 13%. So there are actually higher needs in different parts of the city, which actually are under-resourced. So I'd like to bring you now, Ms. Jill, and I'd love to hear about your work and tell us a little bit about this wonderful department and the Center, rather, for Arts and Medicine at University of Florida.
Thank you, Dr. Gigi. I'm really delighted to be here with you all. So the Center for Arts and Medicine is based at the University of Florida in the College of the Arts. Had the pleasure of being in the center since it was developed in 1996. So we are an academic and research unit in the College of the Arts. We also exist as half of a whole, which is the Arts and Medicine programs at the University of Florida. So before the center was developed, the UF Health Shands Arts and Medicine program was created in the late 1980s. I became an artist in residence, one of the first 2 artists in residence in that program in 1994. I was doing dance with patients in the hospital. That clinical program has now grown. We have 15 artists in residence across disciplines working in the hospital and in the community. Our program extends far outside of the hospital walls and into the community. Our artists have about 15,000 patient bedside visits a year, and we have about 20 free community-based and now online as well programs per week. So we have a really vibrant arts program. We're a national, in the center, we're a national creative forces site, as well in partnership with the Malcolm Randall VA medical system. So in the center, we're an academic program. We have graduate programs and undergraduate programs. We have over 80 graduate students in arts and medicine now, and our MA in arts and medicine, and our 2 graduate certificates. We also have 4 undergraduate certificates for on-site students. Our graduate programs are online. We also have 2 very vibrant research labs and a faculty, 8 amazing faculty who do incredible research across disciplines and across health issues. Our work collectively looks at how the arts work in healthcare and how artists work in healthcare, and centers very primarily these days around public health as well. Our interdisciplinary research lab has 30 members, faculty, staff, and students. We conduct an array of mixed methods studies. We tend to run anywhere between 5 and 10 studies at a time. We maintain the National Arts and Health Research Database on our website. and just stay really busy in that lab. I'm also so excited that we now house a National Endowment for the Arts research lab, which is called the Epi Arts Lab. And this is a partnership with Dr. Daisy Fancourt at University College London. It's also a partnership with Bloomberg Philanthropies and the Pav Steinmetz Foundation. And this lab extends the work that Dr. Fancourt has done at University College London, which has demonstrated incredibly compelling population level outcomes that result from arts and cultural participation. Lots of that work is around aging populations. So the EpiArts lab at UF extends that work to the United States. And we're doing a set of about 20 statistical studies, epidemiological studies, using 7 longitudinal American data sets. And we are assessing all sorts of outcomes and the impacts of arts and cultural participation around those outcomes. Again, focusing a lot on aging, and I'll talk a little bit more about some of that work in a little bit.
Yeah, well, I mean, you guys are doing so much and really, as I say, innovative in a space that really, you've been doing this now for decades, and really we want to be able to learn from you. I don't know if we can duplicate all the amazing work that you're doing, but wouldn't it be nice if in all health centers, hospitals, clinics, and in the community, that this is something that's just part of what's available, and that it allows people not only to get better from having an illness, but also to improve the quality of life. So, you know, in England, they actually have a loneliness minister that because loneliness is just as damaging to your health as smoking a pack of cigarettes a day, right? And certainly the pandemic has been very socially isolating. I mean, as a general internist, I can tell you that people, you know, whatever age, whatever demographic, gender, et cetera, people have had, you know, difficulty, myself included, for heaven's sakes, you know, to not be able to see your friends and family and, you know, thank God for my cats, but not to be able to, you know, I mean, it's been just a weird time and very isolating. So my first question really to both of you is, for all these wonderful programs, you both have sort of alluded to doing things online, but how do you do dance online? How does that work out? Either one of you.
I mean, dance online is like any other practice in our discipline. It's call and response. It's using people's names to engage them in making a movement. It's, you know, it might be using text from a poem to ask somebody to make a motion. You know, Gigi, I see you shaking your head. So, you know, any incorporation of movement that somebody might put into the frame can be collected together and assembled together into a choreographed dance or movement thread where, you know, we're kind of calling for people to make movement responses, and then having us kind of perform them together, you know, one by one, and then together at the end, so that we've created something together. We put something new into the world together. So it's not about a beginning, middle, and end of a dance. It's really about being present in the moment and creating a movement or a dance that speaks to something that is there with us, is there and present. And it could be a response to a poem or a text or a news headline. It could be a response to, you know, your cat that I saw, you know, your cat or the background of in Jill's thumbnail. So there's so much that can be done in this two-dimensional space. It's been fascinating to see our teaching artists kind of come alive and learn how to adapt these in-person programs that are typically in adult day centers or community centers or continuing care retirement communities, and lift them up into the virtual world. There's so much really that can be done within these frames.
What do they say? Necessity is the mother of invention. It's true. I mean, you know, you take a catastrophe and there can be some very nice silver linings that really shift how we do things. So Ms. Jill, please give us some specific examples of how arts impact health. You know, you said that you've got all these huge databases of probably hundreds of thousands, if not more, people that get followed. Can you give us a few examples of what that looks like?
Yeah, there's so much to share, Dr. Gigi. I mean, the findings that have come out of the UK from Dr. Fancourt's lab have been quite compelling. I mean, she's used 2 longitudinal data sets in the UK, including one that's quite amazing. And I think 1947 in the UK, they consented every baby born in 1 week in the UK to a lifetime longitudinal study. And 95% of those babies were consented to the study, and 85% of them have stayed in the study throughout their lives. And now I think they're in their 80s.
Wow.
So incredible database. So that's one of the 2 longitudinal databases used there. And DAISY studies have found some really amazing outcomes, such as that people who participate in arts and cultural activities just once a month or more are like 48% less likely to develop depression in older age. At the other end of the spectrum, children who show marked creativity and engage regularly in arts activities are about half as likely to be maladjusted in various ways. And that's a huge determinant of lifelong health. So her studies show outcomes that compelling around things like chronic pain, mental health, depression, age-related disability, overall well-being, and even longevity. DAISY has repeated some Scandinavian longitudinal studies that were done in Scandinavian countries in the 1990s, 16-year study. And then I think about 14 years later, there was a follow-up that with highly controlled studies for things like socioeconomics, education, income, those sorts of things, showed that people who engage in arts and cultural activities live longer. DAISY re-ran those studies using the UK data and found the same results. And those, again, across demographic groups, independent of socioeconomic variables. And those findings, all of those findings are holding up across demographic groups. So they're very compelling. So in our work so far in the EpiArts lab, we've conducted 7 studies. And we started because we were very, very concerned with a number of things in doing this work in the United States, recognizing that we have very different social, arts, health contexts and political contexts. We're not a socialized health system in the United States, for instance. So we wanted to start by looking at the landscape. So we started with a study that looked at the demographics of who engages in the arts in the United States. So looking at patterns of engagement across demographic groups. And of course, in that study, some of the disparities that we've been aware of across race groups are holding up, across age are holding up. And we actually saw increases in racial disparities in arts participation between 2003 and 2016. So there's a lot to look at there. And so now we're working to drill deeper and look at variables that aren't easy to assess in these studies, things like systemic racism and structural racism, things that don't come up in the questions that were asked in these studies 20 and 30 years ago. So those are some of the challenges that we're trying to work out as we engage in these studies. We've also looked at predictors and barriers to arts and cultural participation across age groups. We've looked at differences in interested non-attenders and people who attend, variables like education of the individual, education levels of the parents. Again, we're finding some disparities across age groups, but we found a couple of interesting things in that study that across demographic groups, there were similar levels of interest and fewer disparities, fewer barriers reported across some non-white groups, for instance. So very interesting findings there that are also helping us understand the landscape.
What do you mean by that? What do you mean by that? I didn't understand.
So Black and African-American groups are reporting fewer barriers, for instance, to arts participation. And older adults are reporting fewer barriers to arts participation, but more barriers, for instance, to cultural participation. So going less to performances and more formal arts activities where transportation may be an issue, for instance, that probably is a primary issue, and less barriers to things like participation in clubs and home-based arts activities.
I see. Well, as you're talking, I'm thinking about our city of Washington, D.C., which, we have so many arts venues. I mean, we've got the Smithsonian, we've got, of course, the Kennedy Center, and I'm very delighted that my friend, Ms. Debbie Rudder, who runs the Kennedy Center, has really deliberately made sure that the programs were diverse to engage different kinds of people. And as a matter of fact, I think before the pandemic, they opened up a REACH program. And she said that there were 150,000 people that came that had never been in the Kennedy Center. And what we have noticed with some of our programs is that especially children that may live in Southeast have never set foot in the mall or, to look at the various lovely museums and arts opportunities, because all this is free, which is what makes DC unique. And then not to mention within communities, Southeast, certainly the church is a very huge place for artistic expression. One of the large churches in Southeast Washington, D.C., Temple of Praise, that has up to 10,000 congregants. I've attended several services there, and it's delightful. I mean, they've got a group of dancers that perform of different ages, of course, people who sing and so forth. So that, it's just amazing. So, but it sounds like from what you're describing is that there may be people who, I guess the people who are homebound or shut-ins for whatever reason, either because they're physically, disabled, or to your point of transportation, right? Or some other reason, cognitive impairment. So when you're thinking about and designing these programs, what are the intentional, deliberate steps, for you, Janine, you've mentioned some of them, that can really engage as many different people, especially the ones that are really at higher risk for isolation, for poor, quality of life, because it's not just how long we live, it's like what the quality is. I'd rather live, to 100 with a good quality of life than to 150 and just hang out, right?
Yeah, so we're all about customization. So it's not like we have canned programs that just apply in all the same ways in all the different communities where our teaching artists are leading workshops. And so, core is that our teaching artists are present in communities where older adults are already living or they're congregating for programs. So we're going to them. With online, it's different. We're all coming together in the cloud. But there's also very deliberate partnership steps taken, making sure that we're listening to the needs of the client partner, of the adult day center, of the community center, of the village. We're having conversations with East River Family Strengthening Collaborative in Anacostia, as well as we've been working with the Deaf and Hard of Hearing Center in Anacostia as well. And we really, our teaching artists and our program director do a fabulous job of listening to what the needs are, listening to maybe what content, what's interesting in the way of content, and how we can modify and adapt the programs to suit the needs and the interests and the loves and the cares of the communities in which we're working. So that's really core to the program, as well as in the moment, when we're in the frame together or when we're in the room together, our teaching artists really have a talent, a knack, and this is, I think, innate in most artists, for improvisation. And that's a core value of ours, to be able to take a creative turn in a workshop. Maybe it's not what you were planning, but if somebody, if a senior or a caregiver wants to take it in a different direction, the teaching artist is going to employ that basic tenet of improv, which is yes and. Let's go there. There's no wrong answer. And that really makes people feel whole. It makes them feel like they're a part of a program that's for them. and for their community. So we're very intentional about developing the partnerships and tailoring the programs to the needs, themes that might be running through, through a particular center's season. So we're not canning programs and just kind of leaving them to be opened up and practiced. We really are taking creative turns everywhere that we can.
Well, I mean, you've just described an ideal health care system where the individual is being seen as being autonomous, and his or her dignity is being respected, and they're being looked at as a whole human being. And so for you, Ms. Jill, being in an arts and medicine program, or department rather, center, keep choosing different words, forgive me, how does that translate? Because you do have a lot of people that are working in hospital systems where, let's be honest, the hospital system is not always looking at human beings that way. We tend to fragment people and say, okay, you've got a lung problem, have the lung person see you. You're not really looking. So how has that worked out in terms of the programming? And do you find that, sort of a halo effect is that you've actually educated the clinicians and other people within the healthcare system to adopt that more holistic approach?
Yeah, those are such great questions, Dr. Gigi. And I think the reason that healthcare institutions are investing in the arts is that artists and arts programs represent a significant way in which hospitals can provide holistic, patient-centered care. The truth is our specialized care providers have to be really focused, and they quite often, because of work demands, don't have the time to spend doing the things that are holistically healing, right? Attending, listening, comforting, those sorts of things. So we actually did a study several years ago to investigate and articulate how artists are a part of the interprofessional care team in healthcare. And so we interviewed all of the nursing staff on one unit. So 31 members of the nursing staff. We did in-depth interviews, and we learned a lot from them. We learned a lot about how they think about artists, how they interact with artists. They talked a lot about how artists extend the care that they provide. They feel that they succeed in providing holistic care when they can call an artist in, and when they come back in a half an hour and they see a beautiful, deep, comforting engagement happening, they have a sense of accomplishment in that. So though they can't provide it themselves, the artists work very closely. And in our program, a number of artists are embedded on particular units. Some of them over the years have attended weekly staff meetings with the clinical staff so that they're not clinicians. I don't want to create confusion there. They are not clinicians, but they do function as members of the interprofessional care team in that they provide essential services. And in doing so, they're often contributing to the care goals of the care providers and of the units. And right now, we know from old data, we actually don't have fresh data, but we have Joint Commission surveys from 2007 and 2009, I think, 2004 and 2009. And even in those years, we saw that with very, very high response rates from accredited healthcare institutions in the United States, about half of hospitals then were investing in the arts and in artists. So we presume that number to be a lot higher. And I think we're at a point now where this, arts and healthcare practice is very well established. I think many people reasonably expect to be able to engage in arts and culture and creative activities when they're in the hospital. And care providers also expect that. It's a part of the supportive environment for care providers. Absolutely. We're very careful in our practice not to inadvertently provide negative distraction to care providers through the arts, because we can do that if we bring the arts to the wrong place at the wrong time. But we do try to enhance the entire environment of care, and we provide direct programming, as Janine's programs do as well, to care providers.
So it's interesting. You said that the artists are not clinicians, but they are healers. I think that, people can have an MD or, behind their name and not be healers. And people who maybe don't even have much of a formal education, like my late grandmother was one of the biggest healers that I ever knew. So I think that it is important, at our hospital at GW, now it's been maybe at least 10 years, they have pets that come in, as well as musicians that come in, which is lovely. And it's interesting. We had a in-person panel. This is before the COVID, and we actually asked, and they actually brought in the dogs. And they said that it's actually the clinicians that actually benefit most from them, especially in the emergency department. And people just really calm down, and music as well. I think that one of the things that's been very challenging during the pandemic is the burnout of clinicians and other frontline people, in the healthcare system. And so I love it when there are sort of the dual benefits, when there can be bi-directional learning and influence and healing, because I think that makes a difference. When one is in a crabby mood, you emit that energy and people pick it up, and often the people who are most vulnerable pick it up the most because they can feel it. So there's a question in the chat, and I want to make sure that or comment. Okay, so this is from Dr. Linda Raphael, and she says, I try to picture the 15,000 hospital visits. Does someone with a guitar come to a room and ask if the patient would like to sing? Does someone come around with a trove of poems and ask if the patient wants to hear some? Does someone come around with colored pencils and ask if the patient would like to draw? How does it work?
That's it. All those things. Yeah, we have highly skilled musicians and visual artists who do come by the room and offer those things, but most of our services are provided by referral. So we, physicians, clinicians of all sorts, we get a lot of our referrals from nurses, as a matter of fact, can make referrals for their patients within the medical records system. Patients or their family members can call. As I mentioned, we have some artists who are kind of at home on certain units and make it their business to go around and meet the patients and offer services.
Mm-hmm.
So yeah, it's sometimes performative. Often musicians will, play music for a patient. That we practice live preferential music. We use a specific protocol for assuring as best as possible that we're playing the patient's preference. And they also will drop in and work over, days and weeks to write songs with patients, as a form of storytelling. And patients leave with a song that they've written and that our musicians, record and perform professionally with them. We'll set up a whole recording studio in a patient's room. There's some videos on our website. Actually, we've got a huge YouTube channel and lots of videos on our website. So all those things happen.
Yeah, I mean, what you're describing, it makes such sense, and so much sense. And with all the different things that the healthcare costs and, the exorbitant costs, this just seems like such a small investment with a huge return on the investment. But, as you're talking, I'm thinking about children's hospitals, because certainly in the pediatric world, pediatricians are the best people. They're the best of all doctors, for sure, the kindest. And then geriatricians are, people who are working with vulnerable populations. But, whenever I go to Children's Hospital, it's amazing. The color, the paintings, the activities. I know that they do art with kids. They've got, all of that. And that makes sense. So we know about the hospital. Do you have programs in the outpatient setting or in other settings?
We do, and in the community, yeah. So we have a physical space in the hospital that we manage, and we hold programs there. We also work in our community senior center, in different sites all around our community. Okay, so Ms. Janine, what would you like for people to know about Arts for the Aging and the work that you're doing? If there is maybe one or two things that you would like people to know, to highlight, what would that be?
Well, we are working hard to re-expand our programs after this past year. We've been able to work with a few dozen of our client partners in the region over the last year, and we're working really hard to get back to a lot of the other community and residential care settings that haven't been able to benefit from the programs over the last year because they just either they haven't been up and running or they don't have the technological platforms. And always we're a nonprofit, and always community support to keep this program going is vital. And I really want people to think about the arts as more than just entertainment. And we're not about art for art's sake. There's so much more that the arts brings into our lives, and there's so much evidence-based. Jill touched on some of it. And so much research that's coming out, as you've touched on it too, Dr. Gigi, about the benefits of regular arts participation. So, I mean, think about going to a museum, think about social prescriptions for yourself. Gigi, if there's one thing that maybe I could recommend, or that I would hope that this country would adopt and hospitals would adopt, is social prescription, social prescribing. And, doctors telling people to, go look at art in a museum, go see a musical performance, go make a dance together, write poetry together. These are things that lessen anxiety, that ease stress. And so just be thinking about the fact that everybody has creativity that resides inside of them, and to engage it is a healthy and powerful way to lead one's life. And just not to forget that we all have lifelong potential, and that the older we get, the more important it is that we can express that. And so just to care for and don't forget about older populations. They are marginalized, and we have so much to learn from them, and there's such a richness there to bring out through the arts.
Yes, and storytelling is another creative outlet. We have Ms. Ibe Crawley, who is a person, she's an artist that works with women who've had breast cancer, and she uses scrapbooking as a way to help them tell their story, so that after a workshop they can actually go home with their story with them. And I think that's one of the myths that people say, well, I'm not creative. Well, we're all creative. I mean, if you look at a baby or a toddler, everybody's, kids are moving and dancing and humming, and so I think that there tends to be a rigidity in our society about thinking about, well, if you're, into science, then that's all you do. And the reality is that we're all creative. But I want to share two stories. One of my late beautiful patients, she died one day before her 101st birthday. She started painting in her 90s. And she was so gifted, God rest her soul. She actually made calendars with pastel, for each of the months. I mean, just gorgeous. And then I have another patient in her 70s who actually now has art shows. So this idea that you can't learn something, and it turns out that they're both natural artists, is kind of a myth. So, Jill, can you cite especially how the arts in things like Parkinson's or other diseases, because I think that we've talked about overall well-being, but what are some of the specific studies with specific illnesses? What has that shown?
Again, this is a huge evidence base, and you mentioned Parkinson's, which is an area where there's some really compelling evidence. Of course, we have to acknowledge Dance for PD, the program of the Mark Morris Dance Group, and the incredible work of David Leventhal and that program. And just to mention as well, you're talking about COVID and those adaptations. They're now having a couple hundred people in each of those classes because people can join from anywhere. So the access has really been expanded for people during COVID. People are dancing more often, since COVID, which is really interesting. And I want to bounce back to our findings that we just got in our COVID study, got back last week. Share that. But around Parkinson's disease, there's evidence that shows that a number of the symptoms of Parkinson's can be reduced during and even after dancing. So there are direct, immediate health benefits for people with Parkinson's disease. There's new research happening around dance for MS as well. We've got a program and a study going here at UF, and there's one in Washington as well. And gosh, I mean, I'm just trying to pull things out of the air. There's so much data and evidence around post-procedural support, recovery from anesthesia, length of stay, those sorts of things, especially around music. Beautiful report was just published on how the arts are used to address pain and substance misuse. The NEA put this report out recently. So there's just a wealth of evidence. Our database is searchable by topic, actually. And if it's okay, Gigi, I'll share our COVID findings because they're just—
Yes, please. I'm chomping at the bit.
So, again, we partnered with Daisy Fancourt at the University College London. She, before lockdown, actually early in COVID and before lockdown, she started a study in which people reported on their daily activities on a weekly basis. She enrolled almost 100,000 people in that study in the UK.
Oh my God, these
Yeah.
British, man, they have big, huge numbers.
Huge.
Wow.
So she analyzed the data of 70,000 people and found strong correlations, or associations rather, between arts activities and well-being. And she also found that 21.4% of people were engaging in arts activities more during lockdown, during the pandemic. So we saw increased arts activity and positive mental health and well-being outcomes. We extended that study to the United States in partnership with Americans for the Arts. We analyzed data from 7,000 people. We didn't do nearly as well as the UK with our enrollments, but 7,000 people is a great number for a study like this. And the findings are super interesting. So we found positive associations like lower depression, lower anxiety, and higher life satisfaction among people who were engaging in reading, music listening, gardening, and things like woodworking, DIY, kinds of activities. And the opposite among people who were engaging in digital arts activities: higher depression, higher anxiety, worse life satisfaction, and less feeling like life is worthwhile among people who are engaging significantly in digital arts activities. Now, these are just associations, right? There's nothing causal here.
Yes.
And that correlated with a lot of TV watching, the same as TV watching. And interestingly, we didn't have a sample of people who did more than 30 minutes a day of arts and craft activities. So among people who did arts and crafts activities at home, they were only doing a little, and they also had higher odds of being depressed and having lower life satisfaction. So there's a lot to investigate there, but
yeah,
really, really interesting findings. We're still digging into that data, but a lot to learn.
There sure is. There is so many questions. There's a lot of discussion. Let me just read off the question from the chat. It's from Ms. Sheila Berman. As a GW art therapy grad, I'm curious about where you see art therapists fitting in here. I have worked with elderly using adaptive art for those with low vision or tremors, as well as memory care hospice. An art therapist could help you build a bridge between artists and clinicians, since many are both of those things. I think you kind of have alluded to that. But that's for sure. And then I think one of our friends, Ms. Laura Violon, would like to ask a question. Can you unmute yourself, Laura? Go ahead and ask. You can unmute. You're still muted. I see your hand up and you're still muted. I don't know how to unmute you. Maybe has to be done from our end, Ms. Carter?
Dr. Gigi, as you're figuring that out, I'd love to address Sheila's question about where art therapists fit in, because they already do in our program, actually.
Yes.
We work mostly with professional artists, but there are art therapists that are part of our faculty as well. And as long as, as long as you can embrace the difference between, making a diagnosis and setting, a course for healing, and kind of work in the improvisational, in the moment, and recognize that what we're going for, our goals are a little bit different. It really is about increasing socialization and interaction and communication within a group, using the arts as a tool to do that. Absolutely, art therapists are part of the program as well. And you're right, there's a bridge there between an art therapist and a clinician that perhaps might be a bigger bridge for a professional artist, but this work is for professional artists as well as art therapists.
And I just want to give a shout out to Ms. Berman, because she has is the one that did the mask making for the kids at Brooklyn Manor. I mean, one of the beautiful things that happened during the COVID is that we had people from one part of the city making these beautiful masks for other people in the city. And so she was one of the leaders. And we, as a result, we were able to distribute thousands of masks that were just beautifully made, and people donated old, bed sheets and so forth. Before I forget, and while we're waiting for Ms. Laura to unmute, maybe you can just put in the comments, because I don't know why we can't unmute you, but if you could just write out your question or comment. We don't want to forget about the Kennedy Center and the NIH's huge initiative called Sound Health. Sound Health is a commitment by the NIH. I think it's, and correct me if I'm wrong, Ms. Janine and Ms. Jill, $500 million to look at the impact of music on the brain. And some of the most interesting features, and you can check out the videos, is when they have a gentleman with Parkinson's and he walks to a doorway and walks back and he's having difficulty, and then they have the metronome beat and all of a sudden he walks and turns around with no problem. So just fascinating work, and want to make sure, because I know we've got 8 minutes, and I do know that we have a video that we want to show. So I'm going to let you sort of do your closing remarks, and anything that I didn't ask you, Ms. Jill, that you wanted us to make sure that we addressed today.
Thank you, Dr. Gigi. It's been great to be here. One question that you sort of floated earlier and we didn't get to, I do want to respond to, and that's how the arts are working in health communication today around COVID-19 vaccine. You started by talking about vaccines today. And I'm pleased to share that I'm currently, as of last week, serving as a senior advisor to the CDC, because the CDC has decided to bring the arts into their vaccine confidence.
Finally.
Oh, it's great. And they've been using the arts in various ways for a long time. But this is a sort of new level for them of centering the arts. So they're developing, and I'm working with them to develop a set of resources for guiding local public health entities in working with local artists, culture bearers, arts organizations, community-based organizations, to create place-based arts and culture-based initiatives and projects to enhance vaccine confidence and uptake in communities. So that's a really exciting development. And the arts, of course, are so powerful. Artists are influencers, they're trusted community members. Art spaces are trusted spaces. That the level of collaboration, I think, will ensure higher levels of engagement, and engagement with reliable health information that can help people make decisions. Well,
we need to talk after this, because the Rodham Institute is part of the steering committee for the Black Coalition Against COVID. And so this is a national organization that's done a lot. And of course, as I mentioned, the demographic of 18 to 45, whether African-American or white or Latinx or whomever, is a demographic that's hard to reach. So we should talk so we can figure out a way of working together. That's amazing. Ms. Janine, anything before we show this last video?
Yeah, I really want to express enthusiasm and just loads of excitement from our organization around museums and cultural institutions like the Kennedy Center that are getting into the work of creative aging or using the arts in healthcare and or looking to how they can expand their audiences to be inclusive of more older adults. Specifically for us, partnerships with the Phillips Collection, as well as with the Smithsonian Institution, have really deeply enriched our programming, and vice versa. We've also helped them bring more of a multidisciplinary approach, for example, to looking at masterworks in the Smithsonian's collection when they're bringing people with memory loss and their caregivers together. So the power that cultural institutions and arts organizations wield in terms of getting involved in the creative aging space is really exciting. And maybe just to shift to this video for a moment. This video will just really highlight what it looks like to be inside of a virtual program. So I'm really excited to be able to show this to you. And I think the program more or less, the video more or less speaks for itself in terms of what the workshop is. So let's take a dive into this program.
Okay.
Great to be here with all of you today. My name is Peter, and behind me I've got Carlos. And if you could now spotlight Lauren Boyle for me, that would be great. She's a wonderful poet, and since it's music that moves, we've also got the wonderful and talented Deb, who will lead us in some actual movement.
Oh, singing, moving, writing verse, talking, painting, beautiful day. We're off for it, lead the way. I'm the wind, I am blowing, sunshine bright. I am yellow, tangible. I am not, I'm the weather, windy day. I'll find myself in this late age. I want to fall, but still I won't. Try to kill me every day, but it fails, I'm on my way. Gotta keep myself together, gotta be myself today. Keep it going, keep it strong. Spirit, family, own the string. Beautiful, I'm the day. Everything clean and bright. I feel good. Music playing on a cool, bright winter day. I'm alive, I'm the sunshine. Beautiful, windy day. Sunshine bright. Music playing on the weather. I'm alive. Move, move, move. Feel the rhythm. Move, move, move. Voice change, not just move. Move together till we all participate. Till we all participate. Till we all I'm alive!
I'm alive.
Wow, that was amazing.
That
That
threaded
is-
together a series of workshops that took place, and then we all came together for this virtual exhibition and debuted the video. And it was incredibly moving, to see staff after seeing the video too, just tearing up with the level of connectivity and engagement that they were feeling again after, more than a year of not being physically together with the people that they've cared for and come to deeply love.
Yep.
So I'm so glad.
It is moving. Every time I see these programs, I'm moved that, first of all, there are such incredible human beings, such as these artists and caretakers, and also the people that are participating in these programs. Every time I lose faith in humanity, I meet people like both of you, and the humanity, my faith is I have it restored again, because you guys are doing such incredible work that is so meaningful. So I just want to thank each of you for coming and joining us. Ms. Jill Tursini, Jill, I've conflated you. Ms. Janine Tursini of Arts for the Aging, and Ms. Jill Sonke at the Arts and Medicine Center from University of Florida. You guys are doing fabulous, fabulous work. And we are better for having met you both. Thank you.
Back at you with that, Dr. Gigi. You are doing incredible work yourself, and thank you for hosting these conversations and for all that you're doing.
Yes, well, it's our pleasure. It takes a team. We've got Ms. Ashanti Carter, Ms. Christina Williams, and Ms. Tracy Bass. And this summer, we've got 5 interns And they're going to actually be helping me co-moderate some of these upcoming webinars, and they're going to design some themselves because we want to make sure that we have a younger voice that's also coming through. So we really appreciate it. And we know what we need to make sure that we have your website so that we can link, because I'm sure lots of people are going to have questions. We want to make it easy on our website as we revamp it so that people can get to you. So thank you very much. Thank you, everybody. Please visit our website if you've missed any of our previous speakers series. They're all recorded, and please share and have a great evening. Thank you. Take care. Okay, bye-bye.